Thank you very much. It's a great honor to be here with you at this conference this morning. I salute the child and youth care workers. Thank you so much. So, good morning, everyone. Madam Minister Mondli Gungubele, Program Directors, Mr. Donald Dagunyama and Fiona Balgowind, Ms. Merle Alsop and Elwin Gallant, distinguished guests, youth and child and youth care workers. This morning I have the pleasure to share with you why the role of child and youth care workers during these challenging times is so important. And I second what Christina Gibson just said, is that you have been so resilient during challenging times, and we'll show you why. So the situation of children today globally demonstrates that we are far behind in meeting the SDGs, as 356 million children still live in extreme poverty today and struggling to survive on less than $1.90 a day. Children are more than twice as likely as adults to be in extreme poverty. You can see that 17.5% of children from 0 to 17 live in extreme poverty versus adults that are 18 years and older. More than half of the global population in extreme poverty are children, while only 31% of the global population are children. So you can see that 1 out of 6 children in the world live in extreme poverty. And from those children, the youngest children are the poorest. Here you can see that up to 19.7% of children between 0 and 4 years old are most affected by this extreme poverty. And you can see the curve going down. If we look at child poverty in the world, Sub-Saharan Africa is most affected, with 2 out of 3 extreme poor children in the world living in Sub-Saharan Africa. And the absolute number of children living in extreme poor households fell in all regions except for SSA. So you can see here the trends on child poverty in the world. Financial welfare impact of crisis is greater for households with more children, as the total income increased in households with more children, and households with more than 3 children, they had their wage income decreased as a result of the impact mitigation measures of the pandemic, with consequent lockdowns and many households losing their livelihoods. Households with more children are also more likely to report hunger. You can see that adult members start to skip a meal, and that some didn't have a meal. Educational outcomes became worse for households with more children, whereby you can see here the trends of households with 3 or more children had less opportunities to follow their educational journey through learning apps or to other social media like TV and radio. So what is the situation of children in South Africa? The estimated population at this moment in time is over 60 million persons, with 36% of children living below the age of 19. And you can see that the state has done enormously well to enhance the realization of socioeconomic rights over the last 26 years, with 98% of children having births attended by skilled health personnel, birth registration rates up to 92%, and 67% of children enrolled in the child support grant. There's antenatal support, immunization, and almost universal enrollment in primary and secondary school. So here you can see that gaps are still falling in early childhood care and development, but especially in care and protection. And we see why. So 36% of children live with both biological parents, 19% of children live with neither parent, and the large majority lives with their extended family. 97% of children are cared for by female carers, and 35% of economically active women bear the brunt of unemployment. Over 94,000 children lost a parent or caregiver due to COVID. They are calling this COVID orphans, but you can see the loss and grief as a result of this pandemic. So in addition to access to services, there are still fundamental vulnerabilities persisting regarding children, as 2/3 of children still live below the poverty line. There's still high inequalities across gender, race, location, and disability, with 1 out of 3 children experiencing a form of violence and abuse before the age of 18, both boys as well as girls. But we also see intensified risk related to mental health and other social ills. We see gangsterism, gun violence, as well as high youth unemployment that leads to anxiety and distress of our youth, which is now up to 60%, 63% of our youth, and leading to mental distress. This was compounded by the impact of COVID and the consequent lockdown, as peers started to miss out on socializing with their peers. The educational journey was disrupted as a result of the closure of the schools. With that also came a closure of the school meals. Multidimensional poverty of children intensified. We also had reports through Childline and through the child and youth care workers that intimate partner violence in households went up, which had the direct consequence on children, with children witnessing and experiencing abuse. So why are then child and youth care workers so important? Because they are working in the prevention and early intervention stage of children living in vulnerable and at-risk families. So they are there to live in the life space of families and identify early signal of distress, as to intervene early to prevent child abuse, exploitation, abandonment from happening by supporting these families in the role of childcare and creating this nurturing framework for children. So the cost of inaction is incredibly high. A Save the Children study demonstrated that in 2015 alone, this led to a cost of 5.9% of GDP, as violence takes a great toll on caregivers and children themselves, dropping out of work, dropping out of school in order to address the negative impact of violence. So why is the role of child and youth care workers so important? Because we have a national development plan that clearly demonstrates that we all need to work together to significantly reduce the proportion and number of children at risk of poor development, and have to invest in children, our human capital, from the bottom up in the life space of children, with children and caregivers themselves, and recognize children's development as the foundation of sustainable development, as to take action to make sure that every child, especially the most marginalized, receive the nurturing care they need to develop. Child and youth care workers, you are in the life space of the most vulnerable children. And I always get very emotional when I speak about you, because I've listened to the impact of your stories from the youth themselves. And it's incredible how you are in that life space and helping with psychosocial support and other services to make sure that children have healthcare, education, nutrition, that the caregiver knows how to do the budget for children. As a responsive caregiver, you provide households with necessary information and opportunities to children to participate across their life cycle through the household visits that you undertake, as well as in the schools, through the healthcare centers, as well as in the Safe Parks, which is a program we so wholeheartedly support. In this world, nobody can take on the challenge that we are facing all together. So it's incredibly important that all actors work together to creating a nurturing care framework around the child, but with a caseworker like a child and youth care worker in the life space of the most vulnerable and marginalized children. So we ensure that children have access to services, that they are safe, nurtured, protected, where they live, play, learn, transact, and access information, and that parents and families and caregivers are all supported with the support they need to creating that nurturing care. And if you look at this bubble of actors, we're in this together with the presidency, parliament, South African Human Rights Commission, civil society, religious leaders, academic institutions, social service professionals, child and youth care workers, parents, children, and youth themselves. And it takes a great effort to raise a child, but we have to do it together with all the development partners on this slide. So when you then look at the nurturing care framework that ECBNI created with the NACCW and DSD, you can see the integrated nature of this child and youth care protection and empowerment model. You have the child in the center with the household visits by the child and youth care worker, who then assesses the well-being of the child, make a care and referral plan, ensure the child has access to the appropriate services on the right, be it your immunization, child registration, your birth registration, ID documents, education, ECD, or your SASA grants when eligible. And when children have difficulties or are living with a disability, referral to special programs, or when they suffer from a form of substance abuse or any form of violence, there's need for referral to specialized services. Recently, we introduced the real-time monitoring tool, which is a device and mobile phone, which you can use to track the well-being of the child real-time in order for child and youth care workers to timely refer the children to the appropriate services and make a care plan and follow up on the well-being, be it food security, psychosocial support, further protection in a timely manner, which is a great planning and accountability tool for accountable governance to respond to the needs of the most vulnerable children. So our recommendations as UNICEF this morning are to continue and recognize the role of the child and youth care worker in the different settings, especially in the homes, in the safe parks, the schools, residential care centers, and also seconded to courts. Ensure that child and youth care workers are well trained, accredited, registered with the council, and properly paid. Only when they are safe, then they can serve others. And I think as child protection workers, we all recognize that they actually have one of the most difficult jobs in this world, looking at the challenging situation children face these days. It's important that also they have a mentor that they can relate to and share the circumstances they face while working with the most difficult families in order to get mentorship and advice themselves, and that the statutory system from your child and youth care worker to a social worker is functioning effectively and is clearly articulated. It's also important that other countries in the region recognize the child protection committees, the overseas committees, and the role that these members play as a child and youth care worker, and that this workforce becomes recognized globally, the same as health workers are recognized globally, so that we make sure we have a workforce in the life space of the child to deal with the appropriate child protection issues at all times. The state can't do it alone, neither can families nor civil society organizations. So we are working towards creating a social compact to accelerate the investments in child and youth care, youth empowerment and youth leadership with government, corporates, philanthropies, other development partners, civil society, and youth themselves with the social service professionals in order to make sure that further investments are going to flow to these vital prevention, early intervention services to allow for further youth empowerment and youth leadership. So I always am so fond of seeing this boy who really shared with us his heart-wrenching story, and through the love and care of his child and youth care worker, is studying now and doing well and is a resilient young person, our future leader. So we are very proud to be at this conference today and wishing you a wonderful day. Thank you so much for the opportunity.